Yes, sir. Good evening, everyone. First of all, I would like to thank the organizers for conducting the wonderful events, that is World Record Series 2, for the continuous effort taken by you, sir. It was amazing. Thank you for the opportunity given to me. Myself, Mahalakshmi, Assistant Professor and Head, Department of Foods and Nutrition from MARUDHAR KESARI JAIN College for Women, VANIYAMBADI, that is in Tamil Nadu. I was working here for the Assistant Professor for the past 12 years. So this is the wonderful opportunity given to me. So I will do my best. Thank you. I'm going to start my presentation. Is it visible, sir? Yes. Shall I start, sir? Yes. Today's topic is importance of nutrition during adulthood. Before going to the adulthood, I would like to say what are all the different stages of life cycle. The first one is infancy, followed by the preschool, and then school going age, and then adolescence, and the next one is the adulthood. In the adulthood, we have different types: late adulthood, middle adulthood, and the next one, old age. Followed by that, we have the main important thing is pregnancy and lactation period. We have all those things. That is, this is the nutrition through life cycle. Okay. Under that, our topic is importance of nutrition during the adulthood. Adulthood plays the main role in our life cycle. The adulthood is a period starting from 20 years of age, that is, extending through the middle age to the old age. Starting from 20 years of age, the adulthood plays the main role in our life cycle. This is the most stable period when the growth and development has been entirely completed during the adulthood period in our life. During this period, all the nutrients are necessary. All the nutrients are required for maintaining the body structure and function. The nutrients such as energy, protein, carbohydrate, fat, vitamins, and minerals. All the nutrients plays the main role for the maintaining of the body structure and function. It is more important for the adulthood period. So during this period, mostly all the growth and development has been completed, even though for maintaining that, we need to take all the nutrients. It is very important to remember that as age increases, the metabolic rate slowly decreases. As age increases, the metabolic rate slowly decreases. So, the adult needs less calories to meet the basal energy needs of the body. So what I'm trying to say is the energy need is nothing but the basal metabolic rate. Basal metabolic rate. That is the energy needed to carry out the fundamental metabolic functions. We are taking the energy that is needed to carry out the fundamental metabolic functions, such as I can say you breathing, ion transport, or etc. All these things are needed. Okay, so for that, as the age increases, we have to take proper amount of the nutrients. So because of that, the metabolic rate slowly decreases. So during this period, we have to take less amount of the calories. And this is because as your body grows older, when your age is going on, when your body grows older, it is renewing the less cells and tissues. During the early stage, what happens? The proteins, that is the tissue repair, the cells and tissue growth will be very rapid. The rapid growth takes place. As when you grow older and older, what it happens? It is renewing less cells. Okay. The tissues and cells will be renewing very lesser amount, and the rapid growth will not be there. So therefore needs less energy to keep it going on. As the body grows older, the tissues and cells will not be renewed fastly. It will be very less. So we have to take less energy. Okay, here I want to tell you one thing. In adulthood, we have three phases. That is, I'm going to tell you what are all the three periods. That is early, young adulthood. The significant events are begins when the adolescence reaches the maximum height. Whereas in the girls, the age 20 years and the boy age 22 years and last until the age of 40 years. This is the early adulthood. Until the age of 40, it is last. Or that is till the age of 40 year, we will be calling it as early adulthood. And the next thing, middle adulthood, the age from 40 to 60 years. They call it as middle adulthood. The person who is under the age group 40 to 60 years or under the middle adulthood. Next one, late adulthood, old age people. Age from 60 until the death is called as late adulthood. So the three phases of adulthood plays an important role. That is the young adulthood till the age of 40, middle adulthood 40 to 60 years, and the late adulthood age 60 until the death. Three phases of adulthood plays the main important role. For that, we have to give proper nutritious food. So, however, the nutrition is of the great importance. Nutrition is of the great importance for the adulthood. The reasons behind that are why we need to take the nutritious food, balanced diet. All the nutrients should be present in the food in which we are intaking. The main reason is to maintain the body function. To maintain our body function, we need to take proper nutritious food. And the next thing, to prevent the development of diseases. We have to prevent the development of diseases. The major leading diseases in India is heart diseases, coronary heart disease, okay, heart attack, heart diseases, diabetes. Diabetes mellitus is also the leading disorder in India. So, which may occur due to the faulty eating or the dietary habits. Faulty eating is nothing but the poor eating habits. Poor eating habits. The person may not take all the nutrients. The balanced diet will not be there. That is the faulty eating habits. The person may be taking during the from the adolescence period, they may be going to the that is fast foods, burger, pizza, so on. So they may not follow during the adulthood also. So all these things have to be maintained properly, they should take proper diet. The dietary habit should be maintained properly. So when we have to prevent all these types of development of diseases, we have to follow the proper eating habits so that we can eradicate, that is, so we can prevent the development of heart diseases, diabetes, and so on, such as hypertension also. The main thing is the age. The age plays an important role, and the occupation. What is the occupation? Either it may be a sedentary, or it may be a moderate, or it may be a heavy worker. It depends upon the occupation of the person and the level they do. That is, said, worker and we worker can determine the nutrient needs of an adult. We cannot give the same calories and same protein and same fat to all the adult. It depends upon the age group, it depends upon the occupation, and it depends upon the level of activity. By keeping all these in mind, we can determine the nutrient needs of the adult. Here, I would like to say the period of adulthood can be divided into two stages. That is, one is young adulthood and the other one is the old adulthood. Here, the nutrient needs are only for the maintenance since the growth has already ceased. That is, I told you in the first slide, the growth and development has been completely completed. During the adulthood, all the growth and development has been completed. So the nutrient needs are only for the maintenance. We have to maintain, so that we have to take the proper nutritious food. The next one, energy. The energy needs and consequently requirements for the thiamine, that is B1, riboflavin, B2, and niacin, B3 will vary largely with the energy expenditure. Depending upon their work, depending upon their energy expenditure, the energy needs will be varying. The requirement will be varying depending upon the energy expenditure. The energy expenditure may be in a different way. For example, for the women, maybe spending in the household activities and also in the office, maybe it varies from men to women. The most important thing is the iron requirement. The iron plays an important role in the women. So iron requirement of the women are higher than men because they lose some iron through their menstrual period. During the menstrual period, the loss of blood will be there. So when compared to the men, women need more amount of the iron. So due to that, most of the women are suffering from anemia because they are not taking proper amount of the iron-rich foods. Due to that reason, the anemia occurs. That is, the hemoglobin level decreases. So what happens? They couldn't able to concentrate on their work. Maybe the first thing is the fatigue, tiredness. The ladies always feel very tired. They couldn't able to concentrate in their work, and followed by that, due to the immune resistance, other diseases continues. So women has to concentrate in the diet during the period of adolescence itself. They have to take proper amount of the iron rich foods, because iron plays an important role to maintain their health properly. After menopause, the iron requirements of the women and men are similar. After the menopause, when the women attain the menopause age, the iron requirement will be equal to that of the men. The physiological alterations may be in the metabolism, like we have pregnancy and lactation. During the pregnancy period, we have to take double the amount of the, that is all the calories, protein, fat, vitamins, minerals, all the things have to be increased for the development of the fetus. The fetal growth. For the fetal growth, we have to take the proper amount of the nutrients. That is, all the nutrients that is also the calorie for the normal adult women. The calorie is 1900 to 2000 kilocalories. During the pregnancy, we have to provide them 350 calories in excess. So during the pregnancy period, we have to concentrate more. During the lactation, during 0 to 6 months, we have to give plus 600 calories. And during the 6 to 12 months period, we have to give them 520 calories in excess. So during pregnancy and lactation, we have to concentrate more and we have to provide all the nutrients. The diet should be balanced for the development of the fetus and during the lactation for the feeding of the baby. So the nutrition plays an important role during the pregnancy and lactation. That has to be concentrated and the proper diet should be followed. The foods must be selected very carefully. If you have to meet the nutritional needs within a limited food budget, that limited food budget also we can give proper amount of the nutritious food. So depending upon their economical condition, poor economic status, we can choose the proper amount of the food. The food must be selected very carefully. The person in the later years of adulthood, that is representing the state when the tissue breakdown is excessive. During the late adulthood, tissue breakdown will be very excessive. The body can no longer compensate for tissue loss adequately. So what we have to do, we have to take proper amount of the protein and then energy, fat, all the vitamins. So during the late adulthood, that can be compensated. So during the later years of adulthood, tissue breakdown will be very excessive. To compensate that, we have to take proper amount of the nutritious diet. Some changes in the body structure and functioning include, that is the reduced basal metabolic rate. That is basal energy rate is reduced due to the body structure and functional changes. That is, we can see the demineralization of the bone changes will be there, tissue breakdown, and lowered efficiency of work by the vital organs. The kidney, gastrointestinal tract will not be will not function properly. The efficiency will be lowered due to the improper diet. During the adulthood, we have to concentrate on all this because this plays an important role. Due to the reduced intake of the diet, what will happen? The efficiency of the vital organs reduced. That is, kidney and gastrointestinal tract, etc. The functioning will not be proper. The nutrient need of the adults on specific characteristics such as, based on specific characteristics such as age, sex, activity level, income, socio-economic background, and the region. So the nutrient needs of the adult depends upon the age. Age plays the main important thing. Age, right from the infancy, I told, from the infancy, we have to provide the proper diet. Proper menu planning should be done. All the food groups should be included. The nutrient needs depending upon the age. And the next most important is the sex, that is the gender, whether male or female. Depending upon their needs, we have to plan the menu. And the activity level, I told you already, the sedentary activity, moderate activity, and heavy activity. All these things varies. For the heavy activity, we have to give more calories when compared to the sedentary activity. And the income, based on the income, we have to plan the nutritious meal for the whole family. Depending upon their family budget, we have to plan the nutritious meal for a period of week or a period of month. We have to plan accordingly. Even in the low budget, we can provide a nutritious meal. For example, we can give them the green leafy vegetables. That is very less cost. Green leafy vegetables can be given, dals can be given, cereals, all these things can be included in the diet. That is coming under all the food groups. So when we give this type of foods, the nutritional needs can be properly managed. And the next one, socio-economic background. Depending upon the socio-economic background, some people may be following the different type of diet. They, due to the less awareness, they may not follow the proper pattern of the diet. So that has to be followed correctly. That has to be concentrated. And the region, this plays the main role. Depending upon the region, that is different type of regions are there. That is, for example, the South Indian, North Indian, and the hilly regions. We have different types. So depending upon the region, the proper diet has to be planned, and that has to be educated to the people. The awareness should be given. So the main nutrient needs, that is the adult require the proper nutrients, when that has to be given properly. Okay, if that is not given properly, all the disease conditions may occur. So the nutrient plays the major important role. Depending upon all these things, that is age, sex, activity, income, and socio-economic background and the region, we have to concentrate properly and plan the diet according to that. And the next thing, factors influencing the nutrient needs of the adult. What are all the main factors that influencing the nutrient needs? The first factor is the sex and the income, age, and the type of activity, which I have told you already. A nutritional requirement varies greatly on the basis of age, sex, body weight, and the level of physical activity. So, depending upon their recommended daily allowance, that is RDA. RDA is given by different research institute. For example, National Indian Council of Medical Research, National Institute of Nutrition, that is NIN, ICMR, different research institute has been given. That has been followed by various institutions. So the RDA, recommended dietary allowance, should be followed for the different age group. So that has been categorized for the level of activity. That is according to the sedentary, moderate, and heavy worker. For example, I can tell you, for the men, sedentary worker, we can provide them the calorie. For example, I can tell you the person is under 60 kg weight, we can provide them 2320 calories. That is for the sedentary. That is 2300 to 2500 we can provide them for the sedentary worker men. And for the moderate worker, we can provide them 2700 kilocalories. 2700 kilocalories. And for the heavy worker, we can provide them 3490 kilocalories. Depending upon their work, the RDA has been given. This is the constant, that is year by year it may be changing. This is a constant value given by the ICMR. For the sedentary, 2320 kilocalories. For the moderate, 2730 kilocalories. For the heavy worker, 3490 kilocalories. We can give them 60 gram of protein. We can give them 60 gram of protein. 1 gram per kg body weight can be calculated. I told you the person is 60 kg. The body weight of a person is 60 kg. For 60 kg, 600 gram of protein can be given. That is 1 gram of protein per kg body weight. For 1 kg body weight, we can provide them 1 gram of protein. So the man is 60 kg, we can give them 60 gram of protein. And the fats may also be varying, that is 25 gram for the sedentary, 30 grams for moderate, and 40 grams for the heavy worker. And calcium, we can provide them 600 milligram. Iron, 17 milligram. And vitamin A also varies, that is retinol and beta carotene, 600 and 4,800 milligram. And thiamine is also varying for the different type of activity. 1.2, 1.4 and 1.7 can be given. Like that, all the vitamins, riboflavin, niacin, pyridoxine, ascorbic acid, dietary folate, vitamin B12 and magnesium, finally zinc. So all these things varies on the type of activity. I told you regarding men, and for the women, for example, I can tell you the age is 55. 55 and the body weight is 55 kg. For the sedentary worker, we can provide them 1900 kilocalories. Whereas for the moderate worker, we can give them 2230 kilocalories. For the heavy worker, 2850 kilocalories. And the body weight is 55 kg, we can provide them 55 grams of protein. The fat will be varying when compared to the women. The men may be higher in consuming of the fat. For the women, 20 grams of fat, 25 grams of fat for the moderate, and 30 grams for the heavy worker. It may be varying. As I told you in the before slides, the pregnancy and the lactation plays a main important role during the pregnancy. I told you 1900 calories for the sedentary worker. Along with that, we can provide plus 350 grams of calories. Along with the 1900 kilocalories, we can provide them plus 350 calories. We should give in excess for the pregnant ladies. During the pregnancy, we should provide in addition for the growth of the fetus. So the nutritional requirement will be varying greatly on the basis of the activities. As I said, sedentary, moderate and heavy worker. Some factors affect the requirement of nutrients in this age. That is, depending upon the energy, protein, I said you, vitamins, minerals, that is calcium, phosphorus, etc. When we talk about the energy, in adults, the daily requirement of the calories depending upon the type of work. An adult doing heavy work requires the additional calories than a person doing the moderate or sedentary work. I told you the example and I told you the how much amount of the calories we are going to give them. Generally, women require less calories than the men because men have more active muscular tissues due to which they have higher basal metabolic rate. So hence the energy requirement is increased in the men when compared to the women. The physical activities and amount of work is reduced when the increase in age. So less energy is required. So why we are giving a very less amount of energy means during the adult age, as age goes on, the physical activities reduced. The amount of work is also reduced. So they will be under the sedentary. They will not doing the heavy activities. They will be doing very less activities and also very light activities. So we have to provide them less energy during the late adulthood. When moving on to the protein, sufficient amount of the proteins are required for the continuous wear and tear of the body. That is the tissues. For the growth of the tissues, we have to provide them sufficient amount of the protein. But in this period, as compared to the adolescents, fewer amount of the protein is required because there is no growth of the body at all. As I told you, when entering into the adulthood, completely the growth and development stops. There will not be any growth and development. During the adolescence, the growth and development takes takes place and everything completed during the adulthood. So when compared to the adolescence, the amount of protein may be reduced and the less amount of the protein is required because during the adulthood, the growth is not taking place. And we're talking about the recommended daily requirement of protein is linked with the body weight. As I told you, an adult requires 1 gram of protein per kilogram of the body weight. The body weight of a man is more than of a woman in the same age group. Hence, more proteins are required for men. So, depending upon the weight, the should be given, and when compared to the women, men should be given more amount of the protein. And next one is the calcium. With the growing age, the deficiency of calcium and phosphorus makes the bones very weak and brittle. In some person, it leads to a serious problem. You all know the major old age people are affected by osteoporosis, bone deficiency, mainly because of the mineral calcium and the phosphorus. The bones become very weak and fragile in this case. But these changes in bones do not occur in all the adults. So, when we talk about the deficiency, what is the main reason? Because of the lack of the nutrients, mainly the calcium and phosphorus. Right from the infancy, preschool, and during their childhood, they have to take proper amount phosphorus rich food that may not affect during the adulthood. When they enter into the adulthood, immediately they are getting the bone weakness and bone deficiency. That is nothing but the osteoporosis. It is very common nowadays. We can say that 75 to 80% of the adult are affected by osteoporosis. So, when the age grows, we have to concentrate. Pregnancy, that is during the reproductive age in which the iron is stored in the fetus. What happens during the menstruation, loss of iron will be there, so they are in need of more amount of the iron, and during the pregnancy period more of the iron, that is a blood loss will be there, that has to be compensated. Even though the iron is stored in the fetus, that will be utilized after, that is the post pregnancy. What will happen, they need more amount of the iron, so we have to give them more amount of the, that is what is the required amount, we have to give them properly. We have to concentrate on their diet during the adulthood. And the next one is the vitamins. This is also playing an important role. Sufficient amount of the vitamins are required for the smooth functioning of the body. Sufficient amount of the vitamins are required for smooth functioning of the body. The recommended daily allowance of the vitamins except that of the group or same in adult as in adolescent. That is, in the RDA they may be mentioning the same amount of the vitamins when compared to the adolescence and adulthood. The vitamin requirement is same. The requirement of the thiamine, riboflavin, niacin increases with the increase in requirement of energy. When the energy requirement is increased, what happens? The requirement of the B1, B2, and B3 increases. Why? Because they need for the metabolism of the carbohydrate and proteins in the body. So we have to take proper amount of the vitamins. Mainly the requirement of thiamine, riboflavin, and niacin increases. We have to take proper amount of the energy rich foods also. And the next one, the factors affecting the nutritional status during the adulthood. We have three main factors that is affecting the nutritional status during the adulthood. The first one is the social factor, and the second one, physical factor, and the third one, psychological factors. The social factor. Under social factor, the poverty plays a main role. Poverty, due to the poverty, poor economical condition, they couldn't able to take proper amount of the food. Even they could not able to get proper rice, that is cereals and dal. So that plays an important role, that is due to the poor economical condition, the nutritional status of a particular person is affected due to the social factor. That is main thing is poverty. The second one, isolation. The person who is isolated, that is living alone or in a remote area, they couldn't get proper amount of the food. So that is also one reason. And the poor nutrition. They will be taking the food, but the nutritious food will not be there. That is the reason. And difficulty in food preparation. They don't know to prepare the food properly. So difficulty with food preparation and proper condition will not be there. During when the floody regions, and depending upon the regions, the food preparation is very difficult. And poor knowledge of the food safety. This is the main reason, that is poor knowledge. So due to the poor knowledge, they are not following the proper dietary habits. And the next one, elder abuse and neglecting. Elder abuse and neglecting. This is also playing an important role for the nutritional status. And the last one, institutional environment. Either the person is hospitalized, or the people is in the old age home. They may be feeling very bad. They will not getting proper nutritious food. Whereas when compared to the hospital, the old age home may be varying. So these are all the social factors that is affecting the nutritional status of a particular adulthood. The next comes the physical factors. Physical factors, we have a lot of physical factors. The first one is the dental problem. Due to the dental problem, they cannot able to intake proper amount of the food. Or dysphagia, that is difficulty in swallowing the food. The person cannot able to swallow the food properly. Due to the dysphagia, the proper food intake will not be there. And the next one, diminished sense of smell or taste. They couldn't able to sense the smell or taste. Or due to the dry mouth, xerostomia. Dry mouth, they will not intake proper amount of the food. And the next one, effect of the medications. Due to the different disorders like diabetes, hypertension, heart attack, we have different disease conditions. Due to the continuous intake of the medications, they couldn't able to take proper amount of the food. And the next one, the main important thing, impaired absorption of the nutrients. The absorption is not proper. The absorption function will not be done properly in the body. So impaired absorption of the nutrients and increased metabolism. Increased metabolism, as in Parkinson's disease. Increased metabolism. The Parkinson's disease is nothing but the disorder of the central nervous system that is affecting the movement, particularly the nerve cell. This is the disorder of the central nervous system that is affecting the movement of a person, particularly the nerve cell is affected. Particularly the nerve cell is affected. So during that time, the metabolism will be increased. Increased metabolism will be there. So due to the increased metabolism, proper food cannot be taken by the person. And chronic disease or chronic infection. Chronic disease such as diabetes, mellitus. So these are all the chronic diseases. During the DM, the diet is more restricted. We have to follow proper diet. So during that case, the nutritional status has not been met. Severe problems with the vision. vision problem, and physical disabilities or impaired performance of the basic daily activities, that is including food shopping, cooking and eating, that cannot be done properly. Daily activities may be disturbed or impaired performance will be there. These are all the physical factors. And the last one, psychological factors. The psychological factor, in the psychological factor, the widowed person, so they are alone, they are in a depressive state. The depression is also important thing for not taking proper amount of the food. And the person, when the person is in a lonely state, loneliness and dementia. Dementia is one more thing that is a loss of the mentality, that is impairment of the memory. Impairment of the memory. Memory is not proper, the loss will be there, intellectual functioning loss will be there, that is the dementia. Due to that condition, the person cannot able to take proper amount of the food. And the main important is alcoholism. The person is addicted to alcohol, continuous alcohol, that is drinking continuously. The alcohol is taken by the person continuously. So during that kind of person, the person cannot able to take proper amount of the food. And the next one, fear of choking and other food related anxieties. And the last one, anorexia, loss of appetite. Due to the less appetite, during less appetite, the person will not food. Anorexia is nothing but the eating disorder. Anorexia is the eating disorder. Due to the loss of appetite, when the appetite is not there, the person cannot able to take proper amount of the food. These are all the main three factors plays an important role, that is affecting the nutritional status during the adulthood period. Social factor, physical factor and psychological factors. The next one, aging and nutrition relationship. As the age increases, the nutrition needs more. Okay, the aging process and the nutrition needs. The hormones plays an important role. That is decline in the melatonin. Melatonin is nothing but the hormone secreted by the pineal gland. This is inhibiting the melanin formation. This is inhibiting the melanin formation. So what happens due to the hormonal imbalance? The decline in the melatonin hormone and decline in the insulin. Often that will be resulting in the diabetes mellitus, insulin, and decrease in the growth hormone and sex hormone. Finally, menopause. This is the changes of the body composition, risk of the chronic disease. Risk of the chronic disease. These plays an important role. That is, when the aging process and the nutrition is more important, they need more amount of the nutrients. The hormones plays an important role. When the hormonal balance occur, what is occurring? Decline in the melatonin, that is the hormone secreted by the pineal gland, inhibits the melanin formation, and decline in the insulin that leads to the diabetes, and decrease in the growth hormone and sex hormones, and menopause. The body composition changes. The effect on the food patterns. When we are not taking the proper amount of food, the food pattern varies and the food pattern changes. Due to the food pattern changes, what happens in the body means the gastrointestinal secretions and the motility decreases. The gastrointestinal secretions and the motility decreases, and there will be a reduced senses, that is affecting the appetite. Mostly vision and the taste, smell, everything will be reduced, and the reduced in thirst will be reduced. This is the reduced senses that is affecting the appetite, and reduced physical abilities. The hand function, the movement of the hand will be reduced, and the hand and eye coordination will be reduced. When the age increases, what happens? the coordination of the hand and eye increases. Due to what? We are not following the proper food pattern. Because of the effect of food pattern, all these occurs. GI secretions and the motility decreases, reduced sense of affect, that is appetite, and reduced physical abilities, hand function and the hand-eye coordination reduces. The nutritional need of the older adults. The macronutrient and the fluids plays an important role. The macronutrients, that is, the BMR declines. 1% basal metabolic rate declines 1% to 2% per decade. 1% to 2% declines. A more rapid decline at age 40 years for men and declines means at the age of 40 for the men and the age of 50 for the women. What happens? Gradually the body cells and that is functioning of the body cells will be very less, and the reduced physical activity will be there. When the BMR declines, all these things happen. Gradual loss of body functioning and the reduced physical activity will be there. They will be feeling very tired even when they do the less work. And the mean energy expenditure for the women, that is 51 to 70, and 2066 calorie per day have to be given. For men in that range, that we have to give 2469 kilocalories per day. Many factors that is affecting the energy and the nutrient requirements. Many factors that is affecting mainly the carbohydrate plays an important role. Carbohydrate should be 45% to 65%. That is 450 to 650 calories from the carbohydrates. Mostly we have to give them complex carbohydrates. So that should be 450 to 650 calories. For example, when you are providing for men 2469 calories, from that 450 to 650 from the carbohydrates. Minimum we can give them 130 gram of carbohydrate per day. Per day we can provide 130 gram of carbohydrate is necessary to maintain the normal brain function in both the children and the adult. Fat 30% of the total kilocalories. That is, we are giving 2500 kilocalories. From that, 30% should be fat. 30% of the calories, that is, should be fat. Backup energy source will be there, and fat soluble vitamins, essential fatty acids will be there. Whereas in the protein, 10% to the 35%, 0.8 gram per kg body weight below. That is, I told you for the adult, we can provide them 1 gram per kg body weight. If in some cases during the disease conditions, we can give them 0.8 gram per kg body weight. These needs are related to the protein quality and number of total kilocalories in the diet. We have to check what is the type of protein and protein quality and number of total kilocalories in the diet. Out of that, 30% I told you from fat and 10 to 35% from the protein. 45 to 60% from the carbohydrate. And this plays an important role. That is the water. Water needs relative to the total energy needs do not decline with age. When the age increases also, we have to take more amount of the fluids. So we have to take proper amount of the water. The water plays an important role. The same slide followed. Next one, you can see the figure osteoporosis, how the bone health is there. That is vitamin D and calcium are the main essential nutrients for the growth and for the maintenance of the healthy bone tissue. So we have to concentrate and on the bones, and we have to take proper amount of the vitamin D and calcium rich foods. This is most essential for the growth of the bone. For maintaining the healthy bones, we have to take proper amount of the vitamin D and calcium. And also we can get the main vitamin D from the sunlight. To meet the dietary recommendation for the vitamin D, elderly individuals should consume the foods that are fortified with vitamin D or take a dietary supplement to overcome the reduced ability that to endogenously synthesize vitamin D. That is, as per the recommendations, we can take the vitamin D. For the elderly individuals, they can consume the fortified vitamin D. That is, as a dietary supplement also they can take, or as a fortified vitamin. So that can be stable for maintaining the bones. At last, I'm interested to tell you that what is nutrition through life cycle. This plays an important role. Nutrition through life cycle is nothing but right from the infancy, we have to take proper amount of the nutritious food. That is, all the food groups should be included. We have different food groups, that is pulses, cereals, pulses, meat and meat products, all the meat, that is fish, everything comes under that. And then poultry is also included in that, meat and meat products. And then milk and milk products, all the milk and milk products, the cheese, everything included in that, butter, cheese, everything. So, meat and meat products, milk and milk products, sugar and sugar products, and then fats and oils. That is also more important. Fats and oils is also more important for the development of the body. We have to concentrate in all the food groups right from the childhood, right from the infancy, preschool, school going, and then adolescence, adulthood, and the last stage is old age. So, nutrition through life cycle is more important. We have to concentrate on the children's and also for the whole family. If you are concentrating on the whole family, we can see the entire nation. When the family is seen properly, the entire world will be grows properly. The entire world will grow properly. We should follow in our home. We have to take proper nutritious diet, all the food groups, cereals, the rice and rice products, wheat, maize, jowar, all the millets can be taken. The millets plays an important role. The millets can be taken. And then all the protein, that is all the dals, and then milk and milk products, curd, everything should be included. That should be taken in a proper quantity. The quantity is more important. According to the age group, according to the condition of a body, we have to plan a menu in such a way, and we can take the proper diet. If you are following the proper diet, and during the disease conditions, what are all the restricted diets that should be followed properly? For example, during the hypertension, the fats and oil should be reduced and the sodium should be reduced. They should not take all the more of the oil foods and deep fried foods. That should be taken into consideration. Like this, for the diabetes mellitus, they should take less. They can avoid the sugar and sugar products. They can avoid the sugar and sugar products, and also they should concentrate on the oil foods. They should avoid the oil foods. When the diabetes arises, the diseases adds on. For example, when they get diabetes, immediately cardiovascular disorder followed by the hypertension, and immediately they are getting the kidney dysfunction. So concentrate on the food, save your family and save the nation. The entire family should follow the proper diet, educate the people, give awareness to the people, and change the world as a nutritious world. They should follow proper diet, and everyone should maintain their health, and they should lead a good life. Thank you, one and all, for listening patiently. Thank you, one and all.
Hello, good evening, Dr. Bedkar, sir. And good evening, ma'am. Wonderful presentation you have done today regarding nutrients and what kind of diet we should.
Yes, sir. Thank you. Thank you so much, sir. Yes, sir.
Yeah. So, when we are talking about various kinds of nutrients and nutrition, yes, definitely it has a specific role in our human body, and if they are deficient, there are diseases and disease conditions which one has to take care of. And certain nutrients you'll find they are deficient in the childhood, like vitamin A and iron. Then in adulthood, in adolescence, yes, definitely the iron is low. The requirement of especially females in the reproductive age group increases. That is one thing. Now, to get a pure nutrient, we said that the quantity, quality both matters. That food gap leads to kind of disease conditions. But I think in an urban dimension, we have to consider very important thing is uh, the diet pattern, the food fats, what we call it as, like pizza and burger and other, sophisticated food, what people are enjoying, which are stored for quite a good length of time, and franchises are there. And I think these people are also nowadays, I'm a practicing homeopath, so these kind of people, they develop nutritional deficiencies very commonly. So, if we are telling them to take iron diet, dates, and other things, people are doesn't like it. So, a very important thing is, how we can introduce nutrient diets, nutritious diet, because artificial diets are also have a limited scope. So, natural and as per the liking of the people, that is a big question. So, can you give some suggestion in this regard, madam? Thank you.
Yes, sir. Yes, sir. During the preschool age group, they may not take, as you said, they will not take the line that is dates. What are all the protein-rich foods? They will not take definitely. In such cases, we have to provide them in a different modulated way. That is, we can give them balls. That is, as they like colorful. We have to give them, for example, we can grade the carrot, and we that is more rich in vitamin A, and we can grade the carrot. We can add in the dosa batter. We can give them. One thing is that. And when we come to the protein diet, we can give them the balls. That is multigrain balls can be given. For example, we can give them the jaggery, and then that is sesame. Everything can be blended, and ragi. That is the main source of calcium and protein that can be added, and they can be made it into balls. We can give them. So that is more important during the age group of the preschool. They may not like, for example, we can give in attractive way. So they definitely they will consume, and they will get the proper growth and development.
One more thing I want to add, madam. As you were saying that the energy requirement is as per the nature of work. Some people are doing moderate work, some people are doing sedentary work, and some people are doing heavy work. Plus to
Yes,
that,
sir.
we have to consider the basal metabolic rate of every individual. Many patients, talks about even I'm eating a good amount of food, good amount of chapatis, my weight is not increasing. I'm still like that only because it is because of the BMI. What I feel basal metabolic rate, not BMI, BMR. That we have to keep consideration when we are doing a dietetics practice. And plus to that,
Definitely.
then it comes to this end because we have to find out BMR of every individual. That is also one of the very important tasks. And you have very well pointed out that the lactating females and the pregnant females, their requirement increases as per, because their requirement plus the fetus requirement has to be fulfilled. Otherwise, she may land into anemia or some protein deficiency or calcium deficiency. So supplementations are given there also. Very well said, madam. Thank you. Thank you very much for your great presentation. Thank you, madam.
Thank you. Thank you so much, sir. Thank you, sir. Thank you so much, sir. Thank you so much. I'm very thankful for you for inviting me as a resource person on behalf of the management and of myself. I'm thanking you, sir. Thank you so much for the wonderful opportunity.
Sir, feedback link, please. Sir, feedback link, please, sir.
Thank you, sir. Thank you so much, sir. Sure, sir. Sure. Definitely, I'll do.